morning, and welcome to another segment of Issues That Matter. And I wear this show as a badge of honor because this is a guest that has been a previous guest back in February, and she's back, which I wear it as a badge of honor. But Mary Mayhew, welcome back.
Thank you, Bob. It's a pleasure to be back. I enjoyed my time here before and was looking forward to rejoining the discussion.
I'm looking forward to it as well. Now, speaking of the discussion, now the Medicaid or Medicaid expansion, is that going to be another issue this year?
Well, just as background, of course, as we talked about before, Medicaid expansion was part of the Affordable Care Act. When it was initially adopted by Congress, it was a mandatory requirement for all states to expand their Medicaid programs. The Supreme Court struck that down, arguing that was, at least one justice said, that's like putting a gun to the heads of states, forcing them to do this. So it was optional for states to expand. We felt strongly that Maine could not afford to expand Medicaid. We'd already been down that path as a state before. In fact, we were still suffering from the results. A Medicaid program that had doubled in size from $1.2 billion to $2.5 billion today, so doubled in size, and had been on an unsustainable path. We weren't paying our bills to hospitals. So the Governor LePage, felt so strongly that this was not the path to be on, and worse, it was taking away from our ability to focus on the needs of our elderly and our disabled and ensure that we were putting our limited resources to serve their needs, to support our elderly and our disabled. So he vetoed that bill 5 times. We obviously just had an election. The governor received more votes than any governor has received, and I believe more than 35 years. And we're prepared to certainly come forward and set the table for the priorities that we believe are most reflective for the people of this state.
And
I do expect it'll come back up.
What might those priorities be?
Well, as we're putting together our budget, what we've accomplished in the last handful of years is stabilizing the financial foundation, certainly for the Department of Health and Human Services, and that's been driving some of the financial challenges for state government as a whole. The Medicaid program for more than a decade had been reeling from one financial crisis to the next, $50, $100 million shortfalls every single year. Now, we've stabilized that financial foundation. We had to make very difficult decisions, but by doing that, we had negative spending growth last year. That's unprecedented. And compared to other states, the state of California has $1 billion deficit right now, largely attributable to their Medicaid program. So now we can come forward to the legislature and say, here's the path we want to be on. You know, we've been saying, if you're bailing out the boat, you're not charting a course. Now we can chart a course, and we can talk about the needs of our elderly and a rapidly aging demographic. How do we support people in their homes better, longer? How do we fund the kinds of services and supports in the community?
What are some of the ideas that you folks are speaking about relative to the elderly?
So we are putting forward a budget that will include significant prioritization of services. Typically, they're referred to home and community supports. But in addition to that, there is a program that we fund. It's called Homemaker Services. It is entirely funded with state dollars, meaning it does not draw down any federal Medicaid or federal reimbursement or support. But it is important. And in some cases, we've lost sight of the importance of state programs, regardless of whether or not they leverage federal dollars, a matching dollar. This Homemaker program has a waiting list of more than 600 people. I would argue it's probably grossly under-reported, because once you get a waiting list that size, people probably aren't even putting their names on it. The Homemaker program, the first challenges we all face, aging parents, grandparents, aunts and uncles, we want to help people stay at home And the challenges that they face early on are meal preparation, house cleaning, laundry, the activities of daily living. And this program is designed to help support those services in their home. So we're looking at fully funding that program and reducing, eliminating that wait list, which will also, Bob, by the way, delay the need for more expensive facility-based services, nursing facilities, assisted living. So it's a good investment both to support people where they want to be, but it reduces our expenditures elsewhere.
Now, would modification to a person's home, and I'll say like ramps, if they're wheelchair bound, would ramps be a modification that would be inclusive in that program?
So that wouldn't certainly be part of the Homemaker program, but there are other services and supports. In our Office of Aging and Disability Services, we've been developing plans that are looking more holistically at the services and supports. Part of our challenge that we face is because we've been so driven to maximize federal Medicaid dollars, we get restricted by the parameters of that federal program. So we don't have the same state flexibility. And unfortunately, the Medicaid program has not kept pace with the way in which care is delivered, or more importantly, the way care can be delivered. But even beyond that, Medicaid is primarily focused on medical services and supports. And we know, your example, there's more than just medical services and supports that allow people to live productive lives, to be able to stay in their homes and in their communities. And building ramps and helping to support those services are truly part of what we're evaluating.
Is it more cost efficient to have a person stay in their home as opposed to going to a facility?
It's considerably more cost effective. The only caveat, though, that I want to put out there, there is also, however, a balance between certainly supporting people where they want to be and the concern over cost effectiveness and isolation and the lack of social interaction.
Mm-hmm.
That is
I see that as a critical issue.
It's a critical issue and concern, and we know that with isolation comes depression, potentially, and all of the challenges that individuals face when they become isolated, are not integrated in the community, are not staying active. So we are looking. There's some innovative programs that strike a balance. And we are looking at ways in which to take advantage of those to both support the community center program, to help fund the types of community centers that would benefit our elderly, but also provide medical services and supports that allow them to stay at home longer. So we've got to keep pace with those types of models, and government's not nimble. We don't change easily. We don't change direction easily, but looking at 5 and 10 years out with our aging demographic in Maine, we've got to do a better job of strategic planning.
Well, the aging population tells me that there's a bubble out there relative to dementia and dementia care. Is anything in the works to try and deal with that? And I do vaguely recall reading something that there was a grant that was recently awarded relative to dementia.
Well, I can't speak specifically to the grant, but I can tell you that we've been looking at issues related to dementia, not only just in terms of the types of services and programs that need to be available, but Maine has one of the most restrictive eligibility levels for nursing facility care. Back in the mid-90s, Maine, and many other states have certainly followed suit, but Maine was looking at the criteria for admission to nursing facilities and was seeking to tighten up that eligibility. So today, having dementia alone does not qualify you for eligibility to a nursing facility. We're revisiting that, trying to understand. When I look at some of the applications for nursing facility level of care, and more importantly, when I look at the denials, we're talking about individuals that are still very frail, very sick, very compromised cognitively, physically, and yet they're being denied access to nursing facilities. So we need to revisit that to make sure that we've got an appropriate balance for who needs to appropriately be in a nursing facility and elsewhere, assisted living, et cetera.
Do you think people are being informed well enough that this is a lingering issue out there, a lurking issue?
Well, I think it's like there are a number of areas where people are in denial, perhaps don't want to necessarily talk about, for any of us with aging parents or aging grandparents, that's a tough conversation to have. People don't want to discuss, so what happens when I'm not able to drive, when I'm not able to make good decisions. We wait till the last minute. And when you do that, your options are limited. You may be on a wait list. And certainly as we look at the percentage of our elderly residents in nursing facilities and in assisted living, the percentage with dementia is significant. But do we have our arms around the best model of care? Likely not. We need to continue to look at it. And I'll give you an example. When I mentioned the antiquated nature of Medicaid policy, in assisted living, and this I was going to sound probably too weedy, but the way in which assisted living is structured, it's supposed to be a community-based service from Medicaid, federal Medicaid's perspective. Well, one of the supports that we know is important in a program like that is supervision, cueing people, helping them to the dining room, as an example. Well, unless you're in a nursing facility, we can't reimburse you for that supervisory support. It's an example of the rigid nature of Medicaid.
What was the logic behind that?
Well, I can't. I didn't write it. I can't defend. I would argue there's so much that's not logical. It's not rational. And we're pushing. We're pushing on some of those policies. We're trying to get more flexibility at the state level to design programs that are cost-effective. That still has to be front and center, but are producing better outcomes for people.
Now, is that something you would have to go back to the Fed?
Absolutely. We have to get permission. And when you seek flexibility from the federal government, there are typically strings attached. And sometimes those strings are so administratively burdensome, they are a disincentive to utilizing that flexibility. So we're working more on that. We're talking to members of Congress about why state flexibility with these programs is so critical. Maine is different. Maine, you look at one state. And so states need to be able to tailor these programs to integrate services. One of the challenges that I know I have expressed with you, I have a large agency, $3.4 billion annual budget, 3,400 employees, multiple programs, but many of those programs overlap in terms of the services they're providing, the individuals and families that they're seeking to support, but we don't do it in an integrated way as much as we need to. We're working on that. We've come a long way. But sometimes the reasons we're unable to support programs in an integrated way is because the federal government creates the silos. The funding streams don't allow for a more holistic approach to families and individuals.
I thought the silos were things that were supposed to go away because they found out that the silos were precipitory. I don't know whether that's even correct, but they were part of the reason why 9/11 ever occurred. Because the intelligence agencies were siloed.
We're not talking to one another. These are policies, much like any organization, doesn't have to be government. People get entrenched, and they wrote the policy, they defend the policy, and a lot of what we're doing in the department is asking why. Why are we doing it this way? Should we continue to do it this way? Is this in the best interest of producing better outcomes for individuals and families? And just as an example of the silos and laws and rules that have passed that are intended to protect confidentiality, but may be detracting from our ability to actually help people. And when I look in child welfare and the issues around substance abuse that are destroying families, There are a lot of confidentiality provisions around substance abuse treatment, and the inability to look at a family and their challenges, their barriers, that makes it difficult to bring the right resources to the table and really make a difference to create stability for a family that is challenged with substance abuse or mental illness, to get them on a pathway to stability, to reunite with their children, and to support themselves through employment.
Yeah. Well, the genesis of this program was to talk about Medicaid expansion. Now, I understand that Medicaid expansion is not necessarily the issue that it was last year, because the Republicans made a great deal of headway during the midterm elections, and they took control of the Senate, which will put a major roadblock in the way of those efforts for Medicaid expansion. But let's just talk about Medicaid expansion for a short while, because while somebody may be opposed to the expansion, I find it difficult to believe that there are a lot of people out there that are opposed to the objective, the fundamental objective of providing health care insurance to people that need it.
Well, I think it's important first, though, to reflect on the election and what that election represented from the voters' perspective. So the governor vetoed Medicaid expansion 5 times. The legislature stood with him. Republicans in the legislature stood with him in opposing Medicaid expansion. The Republicans took control of the state Senate. They increased the number of seats that they have in the House, and the governor received a significant number of votes. I would argue that the people of Maine have actually spoken on this subject, and they are aligned with the priorities that the governor and members of the legislature, Republican members of the legislature, have laid out about the prioritization, that we have limited resources, that we cannot strive to be all things to all people, that we've got to support the public-private partnerships, that at the end of the day, what is going to matter most for this state is creating an employment-focused culture, that we need to help support people out of poverty, that if you're on these programs, if you're on Medicaid, if you are enrolled in our food stamp program, that means you're living in poverty. And what I'm tired by and frustrated with is the notion that Maine's poor, we're always going to be poor, and so therefore we need to just grow these programs. We should be focused on how do we improve Maine's economy? How do we help people out of poverty? How do we generate jobs and businesses that are going to turn Maine around?
That speaks to the, help people out and help people up and not help people out.
Let me tell you about a family that I've dealt with. This is a young woman who, she inspires me every time I talk to her. And when I first met with her, she eagerly wanted to share with me her story. And she has 2 daughters, 2 young daughters, and she had had a very difficult life. She was a drug addict. She had been in an abusive marriage. She was struggling. She nearly lost her children to Child Protective and really had no way out, no pathway. Well, she came into the department looking for help. She received assistance through our temporary assistance for needy families, and they got her into an employment environment. She had gone through drug court. She was working on her substance abuse. She interned at a nonprofit, and she talks to me about the value of that, of how that changed her life. She then got a job and began to, not just the income that it generates, but the self-worth, the self-esteem, the confidence. And when I have met with her and talked to her, I've talked about the role modeling she's now doing for her daughters about work and why it matters. She emailed me recently. Some of her emails are the best emails I get. She's gotten promoted, and she's so proud of where she is. And I'm sure that anyone maybe seeing her 10 years ago would have said, what can we do for her? she's a lost cause. And the reality is we can make a difference. People can change, they can improve, and they can get on the path of stability, of independence. And that's where our emphasis needs to be. Medicaid expansion and providing people access to coverage. We can provide them access to coverage when we get them into good-paying jobs that provide benefits. We can improve people's access to coverage by generating a better economy for Maine with more employers. What we can't do is go back to the mistakes of the past and bankrupt state government.
Now, let's talk about now. I don't think you were in your position back in 2002.
I was not.
Okay, back then I think that was one of the first
Yes.
efforts to expand Medicaid. How did that work out?
It's one of those, we know what happened. Let's not ignore the experience of the past. Let's not repeat the mistakes of the past. So that expansion, that was known as an expansion to childless adults. They had estimated that about 14,000 people were eligible, that about 11,000 people would enroll. They passed a tobacco tax increase to fund that expansion. The state had to cap it when they were getting close to 23,000 people enrolling. The tax revenue certainly went away and was no longer able to support the true costs of that expansion. That's also when the state stopped paying hospitals because they couldn't afford the true costs of the volume of services the hospitals were providing. And it just was a domino effect. And again, when you're in a state of financial crisis, you're not managing to your priorities. You're not charting a course. You're responding to the crisis. And that really is reflective of where the state had been for more than a decade as a result of those expansions. We can't afford to go back and repeat those mistakes. And I think, Bob, it's also important to realize that when the state had to keep bailing out the boat and putting more money into the Department of Health and Human Services, that was coming from somewhere. It was coming from increased tax burden, or it was coming from other state agencies like education, like public safety, natural resources. It's hard to prove the negative, but many of those agencies would have come forward year after year with budget priorities of their own, and they were told no, year after year, because the crisis was in the Department of Health and Human Services. So we don't know what investments we haven't been able to realize as a result of those lost opportunities.
If I'm correct in putting two and two together and coming out with four, I suspect that part of the background relative to the closing of career centers, because there used to be a lot more career centers around the state. Now it's about 4 or 5 statewide.
A few more than that, but I'm so glad you brought that up. I think that is a great example. The Department of Labor, that oversees the career centers, is about 98% federally funded, meaning the department has little flexibility outside of those federal funds. And you're right, those career centers have been greatly reduced. And yet when you look at what we're trying to accomplish in the Department of Health and Human Services in supporting people on an employment pathway, we depend heavily on the work of those career centers. So we began more than 2 years ago convening monthly meetings. I sit down with my counterparts in the Department of Labor and in the Department of Education, and we've created a formal structure among our 3 agencies for how we're going to collaborate effectively to help people and hold ourselves accountable for better results around employment. But the career centers are critical. So we literally gave money from our funds to the career centers to hire more staff, and to hire staff that would be focused on recruiting employers to serve as work site opportunities. When you think of some of the people that we're supporting, especially if they've grown up in generational dependency on welfare, they've grown up in poverty, they may not have work skills. They may not have received some of the exposure early on to that experience. So we're recruiting employers where we're just placing people to gain that valuable worksite experience. But the career centers need to be a much larger priority for this state. And it's also, what do we want happening in those career centers? A lot of our individuals need case management. You can't just point them to a computer and say, get your resume developed, get your job profile on the job bank. They need help. They need support.
And I would say that when you mention resumes, I see that as being critical, because back in the days that I was out there actively job hunting, resumes were, you had a certain format and so forth. It has changed so much. And today, when I graduated college, I mean, you went door to door
Right.
to go job hunting.
Right.
Today, no. Many places will only accept it online. And the intricacies of that online process is staggeringly surprising. You know, they time how much time does it take you to fill out that application online, and if it takes you too much time, or if you go for coffee too often, you're destroying the chance of getting a phone call from them.
You should have Commissioner Paquette on. She would love to talk to you about that, because that is exactly what she has focused on, the sea change in how you apply for jobs, how you identify where the job opportunities are. And she's passionate about transforming the Department of Labor to be responsive, certainly, to that change, but also how do we help people embrace that.
Well, if you would like to mention to Commissioner Paquette that, you think you might be able to get an invitation
Have
from
an in?
us.
Okay, all right.
By all means, have at it.
I will do that.
I'd be more than happy, because I learned. I'd like to say that I thought about that all by myself, and I discovered it. No, when I worked with the National Able Network, that's one of the things that I was trained on, and that's one of the things that I would tell people, and I also tell people, don't be afraid of the computer, and realize the computers are not going to go away. They're going to become an ever more important part of your life.
But it's an intimidating process.
It is. It's very intimidating.
And for the folks that we're trying to support, if you are already struggling with depression, if you have been out of the workforce for months or years, you don't have a lot of self-confidence to begin with. So then entering into a career center and trying to navigate that process, it's overwhelming. And that's why we are so supportive of hiring staff that can provide that level of case management. And I can also tell you, we have wonderful emails from people who've benefited, and they write to us and say, thank you, thank you, thank you. I needed someone to look at my resume. I needed someone to tell me what to wear to my interview, or to coach me on how to interview for a job. And they've said, and it made a difference. I got a job. So this isn't just theory. We're now seeing the benefits of people who've actually become employed and who are connecting the dots back to the supports that they received. And we need to get that embedded in our structure. And again, hold ourselves accountable, measure, look at our performance. Are we getting people employed? Are we improving our workforce? That's another thing that Commissioner Paquette can speak about much more eloquently than I can, and that is she has a vision for workforce development that it was really founded on, we need every Mainer. We need to retrain our elderly. We need to engage with people with disabilities to be part of Maine's workforce. If we are going to attract and retain employers, we've got to capitalize on the workforce that we have.
Well, when you speak about working with the elderly, I mean that's what I was doing back in my days with the National Able Network. In any event, what are your closing comments? Because I know you're on a time gun here.
I am. Well, my closing comments would be, first of all, that I'm so proud to be a part of Governor LePage's team his vision for Maine, his compassion for the people of Maine is driving the transformational change within the Department of Health and Human Services. And our focus is clearly on how do we take limited dollars, how do we certainly respect the taxpayers' resources and ensure that we are aligning those resources with our core mission, that we are supporting our most vulnerable, our needy, and that we're helping vulnerable families to become successful, financially independent, and creating future generations for this state that can be part of a vibrant Maine and a healthy economy. So I'm excited about where we are and truly the opportunity that we have to continue to chart that course.
Well, I want to thank you again for reappearing on the show.
It's a pleasure.
And we got to do this more often.
You call. Just
All right.
call.
A pleasure. A pleasure.
Thank you.
Folks, have a great day. Enjoy it. Simplify your lives and make it a safe one. Have a great day. Bye-bye.